Is it any wonder the White House won't say how many Obamacare enrollees paid? The tweet that may be saying it all. They signed up, now they need a reminder to pay up. Is Uncle Sam's tweet telling us something about how many Obamacare enrollees have actually forked over cash for coverage? Michelle Fields thinks so. What do you mean, Michelle? Take us through what's going on. What's that tweet? What's the tweet that we're talking about?
Well, look, they're desperate right now to try to catch up and get people to pay for the health insurance. The problem with the Obamacare healthcare enrollment number is that it's not actually an enrollment number. They claim that Obamacare is this huge success because they have 8 million people who've signed up, but that number doesn't mean anything unless we know how many people have actually paid for healthcare. And the fact that they have this huge campaign right now to get people to sign up for Obamacare shows us that it's probably a large chunk of people who haven't actually paid their premiums, and that number is a bit exaggerated.
Michelle, I read somewhere today on Twitter that the Georgia healthcare exchange, somewhere around only half of the people who signed up have actually written a check.
Yes, if you look at states like Georgia and South Carolina. So in Georgia, only half the people have actually paid for the health insurance, yet they are being considered as enrollees. And in South Carolina, only 57% of the Obamacare healthcare enrollees have paid for it. So that's a huge problem you have there. And it's not only just the amount of people who've signed up for Obamacare. The other big problem is the demographics of the people who've signed up. As you know, the big push is to get young invincibles to sign up. But according to research, of those 8 million people who are enrollees, only 28% are young invincibles. The administration needed 40%. So Obamacare is not the success story that the administration is trying to say.
And we don't know how many are actual Medicare enrollees, because I have to assume if you're a Medicare enrollee, you're probably counted as paid, right?
Yes, exactly. And the other problem is we don't know how many of these people were previously uninsured. The whole point of Obamacare was to get people who were previously uninsured insured. Yet studies show that it's probably only 1 million people or 1.5 million people who were previously uninsured who are now enrollees. So what was the whole point of this?
Not sure, Michelle. We're going to have to leave it there. Always looking forward to seeing you on Saturday morning, cashing in. Thanks, Michelle.
Thank you.
All right, even if you've enrolled in Obamacare, good luck finding a doctor. Reports out of California show it's already happening. And Dr. Joel Zinberg says it's only going to get worse. Doc, what do you mean it's only going to get worse?
What I mean is that the people who are gaining coverage through Obamacare, and obviously it's a question of how many, but those folks who are gaining coverage are going to gain it primarily two ways. One is through Medicaid, and the second is through the exchanges. And the fact that you have insurance doesn't mean you're going to actually have access to a physician. What you may find is if you're on Medicaid, you're going to find that a lot of physicians don't take Medicaid because it pays extremely poorly. A lot of physicians see patients who have Medicaid, but they don't even bother billing because the reimbursement is so poor. And states who are already buckling under the Medicaid problem and spending more than 50% of their budget on Medicaid are going to find they have to slash Medicaid reimbursement. So this problem is going to be exacerbated as time goes on. So about half the people, according to the administration's predictions, are going to gain coverage through Medicaid.
So Doc, first of all, I read that Cover California, that exact thing is happening already. Talk to us a little bit about the doctors, your profession. I've understood this, I could be wrong, but most doctors do some of the Medicaid business because they're good people. They have to do it, they feel like doing it, they want to do it, not because it's necessarily a good business practice for them to do it. So if more people are on Medicaid coming in, is that pushing good doctors out of the system?
Well, it's pushing it. What's going to happen is physicians who private physicians have historically been the people who took care of Medicaid patients, but that's, as you get more and more Medicaid patients, that's just not going to continue because people can't absorb the cost for little or no reimbursement. The other side of the equation are the exchanges. People are going to sign up for private insurance on the exchanges, but when they do, they're going to find they have extremely narrow networks.
Right.
And their physician, who they've been seeing maybe for 10, 20 years, isn't on that
network. Might be out of network. We're going to have to leave it there, Doc. We're hearing all those horror stories, and I guess you're right. There are a lot more to come. Dr. Joel Zinberg, thank you.
You're welcome.